Good afternoon, everyone. I'm so excited to welcome you to today's webinar. Before we begin, let me ask you, how often do we encounter invisible wounds, traumas buried so deeply within the body that they seem impossible to reach? What if TCM and acupuncture could offer a profound way to heal those wounds and restore emotional balance? If you've ever wondered how to help your patients truly heal from deep emotional trauma, then you're in the right place. My name is Myra Chen, and I'm your host and moderator for today's eLotus webinar. Here at eLotus, we have been hosting educational courses for over 3 decades, and we are proud to be your trusted source for premium CEU content with over 200 speakers, 700 courses, and 3,000 hours of CE. Today's class, Beyond the Battlefield, a TCM and acupuncture approach to healing PTSD, will provide you with transformative tools to help those suffering from trauma and PTSD using the power of Chinese medicine. We're honored to have Mark Mastrangia with us today, an expert with a fascinating background that blends a deep understanding of Eastern philosophy, Chinese medicine, and martial arts. Mark's journey began in the eastern United States, where he developed a passion for sailing the eastern seaboard and enduring interest in Eastern philosophy. He earned a degree in biology from the University of Connecticut, followed by graduation from the Swedish Institute, where he honed his skills in Chinese medicine and was one of the top students of Jeffrey Yuen. Mark is no stranger to high-volume clinical settings. He founded and operated Po Chi Lam Clinic, a bustling clinic that treated a wide range of medical conditions. After closing his clinic in 2016, Mark moved to Beijing, immersing himself in the study of Chinese language, culture, and Baguazhang. His experiences at Guoyi Tang Hospital in Beijing gave him a front row seat to the early stages of the global pandemic, which later brought him back to the US to lend his expertise where it was needed most. Today, Mark will guide us through the complexities of treating post-traumatic stress disorder using acupuncture and the Luo and 8 extraordinary channels, sharing how he can identify and treat the root causes of emotional trauma for long-term healing and recovery. We're also excited to announce that Mark Mastrangia will be teaching another important and impactful course with eLotus this year on May 15th, called Breaking Free from Drug Addiction and Substance Abuse with TCM. This class will be invaluable for practitioners seeking to expand their knowledge on addressing addiction and substance abuse through holistic TCM approaches. Dr. Mastrangia has been speaking with us since 2020 and offers a wide selection of courses you can check out. I'll post a link in the chat room for more information, including previous classes on Shanhan Lun acupuncture, channel theories, acupuncture for Wenbing diseases, and more. And before we get started, please remember to set your chat to everyone so we can all participate in the conversation. If you have any questions for the speaker, feel free to use the Q&A box at any time. And for those of you earning CEU credits, the quiz will be available the next business day for all attendees who meet the requirements. Now, let's begin today's webinar, and please join me in welcoming Dr. Mark Mastrangia.
Hi, everybody. Good morning. I say good morning. You guys say good afternoon. I'm currently in Taiwan, where I live, so in Taipei. So it's early morning here. It's just 7 o'clock. So good morning from Taipei. All right. Let me try to share this screen here for you guys, and then you guys can see what I'm looking at. Oh, wait, hold on. Share this. Yeah, there we go. And let me go here. Can you guys see that on a full screen?
Yep.
Yep. All right. Here we go. Chats are at the top of the page. All right, cool. Sorry, just trying to get oriented on Zoom here. I haven't used this aspect of Zoom in a while. All righty. All right. Well, welcome. Welcome to today's lecture. Thank you guys. Thank you, Tina, and thank you, Myra. This is great to be back. And thank you, Sam, and everybody at eLotus. Yeah, so today we're going to talk about TCM or Chinese medicine in general. This is actually a more classical Chinese medical approach to emotional trauma and PTSD, right? and we'll go over a little bit about how I define that. Actually, I found in producing this course and talking about these things, PTSD is actually not a well-defined thing. This is kind of wild, but if you go into the medical literature over the past, you know, 40 years since it started to be used in the 1980s, um, nobody really like the idea of what it encompasses is actually sort of this cultural shift that kind of moves back and forth. And so I'm going to go with what I feel and what I've experienced PTSD is in people. Uh, yeah. With that said, I just want to say too that this is an introduction. This is by no means a um, uh, a hugely in-depth thing, even though the notes are going to seem in-depth. The aspect of Lomai, I am looking at one aspect of the way to treat emotional issues with Lomai that are far more aspects. The Lomai are very extensive. They treat gastrointestinal disorders. They treat everything in the Ing level, like Ing Chi cognitive level. They treat internal pathway conditions. It's just very, very, very complex. They treat cardiovascular issues. And the teaching by my the 8 extraordinary vessels treat an immense amount of things in the Constitution. We are taking a sort of broad look at this to give you guys an introduction to these things for some things that you guys can hopefully use in um, in clinic, right? So this is what we're doing here. If you are looking for more information on this, then I highly, highly suggest you look around different people's stuff. When people ask me, like, where did you learn? Where did you get this stuff? I graduated from the Swedish Institute, which was a Chinese medical college that Jeffrey Ewan had been implored to start in New York City. He started it as an aspect of the Swedish Institute, which is a college which taught greater or other things, I should say, including massage therapy, um, personal training, a bunch of other things. And the owner implored him to come and teach there, and that's how he founded that. So I was one of, I think, maybe 10 or 12 years of graduating classes. I was the second to last graduating class. Whenever there are a lot of other students of his out there that teach a lot of things. By no means is any one of them better than anyone else in the sense of like who teaches more accurately. Don't fall for that. I know some people fall for that. This the best way to learn this stuff is just go find him, right? And then find people who have studied with him and take the time to kind of study this stuff with them clinically so you can see how to use it. So that's all I'll say for that. And we'll get started here. All right, so clicking through the slides, there we go. So emotional trauma. Let me make this box a little smaller here. I'm trying to, sorry, hold on. It's I can't find my cursor. Here we go. There we go. Um, just trying to make this a little smaller so I can see play. Here we go. All right, so emotional trauma, right? So emotional trauma can encompass many things. And while it can encompass, PTSD, right? So these defining characteristics are defined mostly in journals as the severity of events, right? The majority of emotional trauma experienced by people on a daily basis is not PTSD, right? You might have a distressing situation that's out of the ordinary, but things that like sudden deaths due to somebody with tragedy or versus natural processes, right? If you see somebody get hit by a car, that could give you PTSD. If your grandfather dies at an old age at 98, while it's emotional trauma, it's not necessarily PTSD, right? However, interestingly enough, because they are both root issues in emotions, you can treat them in very similar ways and get similar results. The difference is the depth of the trauma, PTSD's depth and how it enters the body and where it settles in the body, altering oftentimes the person's psyche and constitutional base is the difference. However, with that said, emotional trauma that's not treated for many, many years can result in um, that emotional trauma moving inwards and affecting the psyche if you don't learn how to process it well. I'm sorry, I'm just having trouble seeing the chat and everything. Let me just, I just want to make sure I'm seeing all this. For whatever reason, my my ability to see this stuff disappears when I hit play here. There we go. My mic disappears, but let's leave my mouse disappears. So let's leave that there. So you're going to see a lot of this like talked about commonly. Oh, I have PTSD from this or that, right? While some events are not normal and some can trigger certain things. Again, not everything is PTSD. The idea of PTSD is something where a severe issue happens. It's generally out of the ordinary, not a natural process, right? So a difficult economy and economic situation will cause you can cause you economic stress, right? Or emotional stress. But a sudden natural disaster that wipes out a family business like a tornado and you living through that, that would be more in line with PTSD according to kind of how it's defined, even though in the vernacular today people throw around PTSD a lot, right? um, some events that can be triggering to people um, that seem like they react in a PTSD manner to something that's more common or more light could be because of deeper, um, unstable emotional bases, right? People who get really upset over the way somebody addresses them or not using their name correctly or this or that. That could be a sign of a more deep seated emotional trauma, but it's not necessarily PTSD. In fact, it's not PTSD, right? So I just want to differentiate that here because the aspect of PTSD is something a lot more um, serious than that, a much more serious event, war, right? Displacement due to refugee crisis, such as natural disaster, flooding, famine, things like that, right? All right, I'm trying to, how do I switch? Oh, there we go. So in modern psychology, much of the differential diagnostic happen between general emotion and PTSD is based on whether the experience becomes stuck in the person's nervous system and mental psyche, right? Um, Sometimes a lot of the experiences in somebody's life cause reoccurring psychological shock. Having them sort of the inability to process the previous issue causes these things to reoccur, right? And this is by no means a modern situation. This is something that's been going on for since the dawn of humanity. You know, even animals, right? You can see it in dogs, you can see it in cats, you can see it like that. Um, However, with that said, um, the aspect of old emotional trauma, even if it's not specifically that severe in nature in the immediacy, but the recurrence of it over and over can give you similar kind of, if you're unable to process that and it happens over and over, can give you sometimes similar symptoms to PTSD, right? Um, Often the inability to unattach from previous emotional charged experiences can happen in general emotional trauma as well, though, right? So this is what I was saying. Narratives can replay in somebody's head over and over, justifying actions or allowing somebody to hold on to certain emotions. Over time, this can affect somebody in similar ways. But generally in the agreement, the idea of PTSD is something that happens with a very severe event, right? Somebody, for example, sometimes you'll hear people sarcastically talk about, I have PTSD from this event or that event that's not very severe. That's more of an emotional trauma that they have trouble processing, right? Sorry, this is, for whatever reason, my mouse disappears every time I click on the chat. So I have to keep clicking in and out of this. So PTSD, where the term come from? This term largely started being used in the 1970s, right? As a result of the US veterans returning home from Vietnam War, right? They had mental and emotional and physical symptoms that related to their time in war. By the 1980s, this term was officially used in the third edition of the DSM, right? The For American psychiatrists. And this is where this started to be used. Before that, we had many other terms that we used historically. And in fact, I'm going to just briefly go through some of the historical ideas because actually the written history of people experiencing PTSD mostly comes from soldiers because they often experience the most extreme versions of stress that humans experience, right? And so historically, ironically, this is commonly throughout history and across countries written or societies over time written from the point of view of um, soldiers or the people who interact with soldiers post battle, right? So the earliest records of war include, other than the experience, when people experience the horrors of mass death and destruction, this often becomes, they have chronic and very severe psychological symptoms. And actually, this is where I have a lot of experience treating. I treated a lot of veterans from the Iraq War and the Afghanistan War, and I've treated a lot of people who work in um, law enforcement, people who worked in some pretty dark things, you know, homicide, you know, cases and whatnot, where they're seeing some pretty gruesome things on a day-to-day basis, and they have to learn how to compartmentalize that and put that deep down. But many of them have sort of learned how to compartmentalize their PTSD and push it down. And so this is something that I've worked through with these people, as well as patients who have been refugees from war-torn countries, as well as victims of rape and things like that. I've had a lot of experience working with these types of people, and so you see um, the differences in how they express things, but the root of the emotion and the trauma is still very, very similar in many cases. You get a breakdown of the nervous system, and in some cases in war, you get you see this contagious among soldiers, right? Soldiers start to see other soldiers lose it, and the goal of the general and the people is to keep them together historically, not let this spread, because fear, and you guys read Dune, fear the mind killer, right? This idea that it affects the mind. And so one of the biggest things that I found while researching some of the history of this is that they would pull soldiers off the battlefield who start to show these symptoms and get them away from everybody else, because it becomes contagious, because this fear uh, hits them and it creates these symptoms that ultimately result in PTSD, but it spreads around within other people. And so it becomes sort of a very interesting um, uh, cultural phenomenon or societal phenomenon within those soldier groups, right? Here. So in the past, it's been often referred to as things like hyperarousal. You'll see hyperarousal, you'll see avoidance behavior, you'll have reliving the trauma, right? Going back to, if any of you guys read Indian poetry, Ramayana, uh, the poem written in 2500 BCE describes that, describes actually a demon having PTSD after nearly being killed by the story's hero. And ultimately, it leads him to meditate and repent and change his ways. The Epic of Gilgamesh in 2100 BCE torment intrusive recollections as the hero Gilgamesh recounts the loss of his best friend, right? So these things are very, very common, and he can't sleep due to this. And he's going through this torment, and it drives him to do things in his journey, right? Um, the marathon by Herodotus, written in 440 BCE, this was written down in this battle, a marathon, um, by Herodotus. The sudden fright in the battlefields and chronic mental and physical emotions, including blindness, even though the soldiers themselves had received no wounds to their eyes, they started to go blind. They could not take the horrors of war, so their bodies shut down the ability to see anything around them, to experience everything around them. They shut this down to try to stop them from seeing this. Yet there was no recorded. Herodotus makes specific mention to the fact that there was no recorded injury to the eyes of the soldiers. But this was something that he even talks about was, in some cases, widespread among the soldiers. You'll get in the American Civil War, for example, they'll talk about faint-heartedness. They'll refer to PTSD as faint-heartedness, soldier's heart, irritable heart, and even nostalgia, because the idea that they can't get over the event that happened before. And so the word that they use is nostalgia. They can't get over that event, right? So they're kind of stuck in that event from the past. World War One, we have the idea of shell shock, war neurosis, railway spine, and railway brain. The reason why they call it railway is because at the time there was a lot of um, railroads being used to transport things, transport troops, and many times they were bombed, and the trains were derailed, and there was a lot of injuries due to the railways. And the doctors found that when they worked, when either they find dead bodies or they'd work on people who, via surgery or whatnot, for these wounds, they would find lesions along the spine, along Dumai, right? From a Chinese medicine point of view. And they associated the lesions along the spine with affecting the brain and resulting in war neurosis or mental issues that today we would associate and call PTSD, right? So these are these common ideas. In World War II, we called it combat fatigue, right? Battle fatigue. So you've got these kind of concepts, right? In Chinese medicine literature, the term PTSD is a modern term modeled after the Western concept. So it's not a old term. Like the context of this is PTSD is a modern concept that kind of encapsulates this stuff, but the emotional um, issues that feed into this kind of complex have been around forever, like I said. So today we call it, I just gave you the name here,创生后理, 症候群, which means the idea of something that comes after an injury, right? The stress that comes after an injury. So this is the idea here. But there are historical references to injury and treatment of pathology due to extreme experiences and shock and unresolved emotions that are discussed at length, as we all know in Chinese medicine, right? That's no new news to you guys. It's important to understand that there is no separation between the mind, body, and spirit in Chinese medicine. It's always been central. There's no, even that term, mind, body, spirit, is like foreign to Chinese medicine. There's nothing for that. It's all one, right? So they don't have this concept like that. Um, if you go back to the Eastern Jin Dynasty in 383 CE, you're going to find a term, right? This term here that I put at the top of the page refers to Feng Sheng He Li, Cao Mu Jie Bing, which means to be scared of the moan of the wind and the cry of the crane. And the meaning is that when these soldiers lost this war and were fleeing after the war of Fei Shui, what happened is every time the grass moved or you heard a creak or a crane, if you guys have ever heard a crane, they're not exactly the most pretty birds when they squawk, right, in egrets and things like that. It would shake these soldiers who had run away. They would think that there were enemies everywhere and they would get super, super, super paranoid. And this actual phrase is, it comes from this war when these people lost. And so you can see this even historically in China and in Chinese medicine. Let me just check this chat real quick because I can't always see it for whatever reason. Um, so, uh, all right, let's see. I'm just trying to, all right, cool. I just didn't know if there are any questions here. All right, so let's keep going. So, common terms, though, that you'll find in classical Chinese, right, in things like the Huangdi Neijing, right, are the idea, or in Chinese verbiage, are commonly things like Jingji, right, the shaking and fear, right, Jianwang, the forgetful or poor memory due to severe emotional trauma, PTSD and things like that, right, or Qingzhi Bing, which means Qingzhi means like emotions, and Bing means disease, right? So emotional illness, oftentimes associated with these types of traumas, right? Now, it's important to know that when you're talking about emotions, mm, emotions are movements of chi, right? So the directionality of chi is really, really important. So how things move in directions are the most important thing. And whenever you look at this, you want to look at earth as always being at the center, right? So at the center is your spleen and stomach, right? The idea, stomach moves things down, spleen moves things up, right? You get this axis of the two, right? Classically, if you go way back to the Huangdi Neijing, that's the axis, the center, and all the other four elements move around it, right? So this is the axis here. Postnatally, they transform and transport everything. So they have this ability to transmutate and change things and even think about things to change them, right? So interestingly enough, if you look at this last involvement, if you look at the idea of Earth being the transformation in late summer, you can also think of it being, because it changes as things get warm and things get cold. It's like that lever point where things change. You can look at it also as the last 18 days of every season and the first 18 days of the next season. So it's that changing point between seasons, right? So internally, it's also that changing point. It's that axis, right? And in the center, it moves up and down. So in the sense of Earth, this can manage a lot of the movement of chi. Other things will move around it, and it's supposed to help manage this. Now, I know in modern TCM, we think of the liver managing the movement of chi, but actually in the Huangdi Neijing, they talk a lot about the idea of the spleen, the stomach doing this, right? And this is really important because in our bodies, one of the places that really manages things is the chest. I'm sorry, the thing is or our picture here is a little small for me to show you this, but it's our chest, right? So here's our chest. This manages the flow of chi upwards and the flow of chi downwards. And we have this dividing line here, which is our diaphragm. So when you have this, this is like the exchange between upper and lower, right? Managing chi to go up, managing chi to go down. Well, ironically enough, the great lobe of the spleen wraps the chest. So it affects this, right? Low channels, as we'll talk about in a bit, affect the internal nature of the movement of chi. And the great lobe of the stomach, which begins in the abdomen, moves up to the left region of the chest to the area of the heartbeat. So they also move in a channel sense to the chest. And from that internal aspect of the low channels, they help to regulate the movement of chi from this point of view, up, down, left, right, right. And there's a lot of redundancy in Chinese medicine. You'll find a lot of things do this, but this will kind of give way to why you can use the low channels to affect emotions, which are movements of chi, right? That's all they are. And we'll talk about this. So here we go. I have in the middle here, earth is in the center, right? The wood is on the left with spring and east. I've translated all the Chinese terms, so you don't need to worry. Basically, everything I've written here is what it says in Chinese here for you. So you've got water, kidneys at the bottom. It doesn't say kidneys, it just says water. Everything's based on elements, but you've got earth in the middle, you've got wood on the left, metal on the right, and fire on the top, right? And so you've got this associated with the movement around the center of earth. So one of the things that's really important to know as we go on, and I've translated all of these different passages for you so you can understand this, is how does a person's psyche form within them? The Huangdi Neijing talks about this actually. Before we get into the idea of treatment, I want to talk a little bit about psyche. Here we go. Just double checking these messages. Okay. So the idea of the creation of psyche in a person. Oh, yeah, sorry. I can't for whatever reason open this and check the messages at the same time. Okay. The idea of the creation of psyche is really interesting because I read classical Chinese, and one of the interesting things is in the Ling Shu chapter 8 in the chapter called Ben Shen, right? The idea of the root of the spirit. A lot of you guys like this idea of, Chinese medicine being rooted in spirit, right? Or the diseases are rooted in spirit. Chibo talks to Huangdi, and he talks about that when then heaven gives him his virtue in the sense of the ancient Greek virtue, the meaning of something, and earth gives it its chi. And when these flow and Jing interconnects from two people, having sex and having a baby, you actually you get this interconnection and you get something called the spirit. And the spirit comes in the Shen, right? And from this spirit, you get the Hun, right? Associated with the liver, right? And then from there, it's going to move on to the idea of once you have the spirit and the Hun, you can then finally get the Po. And when these kind of spiritual aspects solidify in a person or come in and create somebody, then you get the heart. And on the creation of the heart, then you get memory. So when you have a heart that's moving like this, you start an animal, a person that has a heart can start to hold on to memory. The heart is functioning correctly. When you have memory, you can create intention, the ability to form concepts. Because if you can't remember things, right, then you can't form intention. Intention collects and stores, right? And as you create intention in things, now you can have an intention in something and you can create an aspiration to it. So really in the 8th chapter of the Ling Shu, they're already describing the slow creation of psychology in a person as they develop, right? And as this this aspiration develops, you can store the transmutations. What does that mean? It means that I have this will, I have this aspiration. I go out into the world, I watch things, I see how things change, I see what happens, I see the response to my actions, and then I have to respond to things that are happening to me, all of these changes. And then I start to ponder. I can now have thought. I start to think about this. I start to think about the feelings about my memories. Oh, I miss my mother, I miss my father, I miss my friends, or I miss this place I was at before. And you start to have this thought and this ponderance of long distances, right? Things away that aren't next to you. You can't have them immediately because you've gone out in the world and observed things, right? And as you start to ponder these things and you think about how you've done things in life, then you create wisdom. So this idea of how you build psychology, how you build wisdom in a person is discussed right in the 8th chapter. And this is something interesting because when people get injured, when their heart gets injured, when their will gets injured, you notice a lot of the things that come after that get cut off, right? So when people's will gets injured, the ability to look at and ponder the changes in society or the world and see how to make them work for yourself, it's kind of slows down. So if you look at what they're listing here, if you can tell where people are cut off in this A to B to C in their mental thinking based on what isn't coming afterwards, what they're not able to form. If they're not able to create wisdom, but they're able to create everything else, then possibly the ability to think clearly is cut off, right? So all of these things, the Huangdi Neijing was talking about this from a very, very early point, right? They describe symptoms of how emotions affect the body, right? So in the 39th chapter of the Su Wen, they talk about how the 100 diseases are born of qi, right? The movement of qi. Anger rises. Anger causes qi to rise. Happiness causes qi to relax and kind of dissipate a bit. Sadness causes chi to diminish or deplete, right? You get very exhausted from sadness, and oftentimes chi comes inwards. Fear causes chi to descend downwards, right? Cold causes chi to contract. Intense heat causes chi to leak and drain. A lot of sweating, right? That's that loss of chi. Fright shock causes chi to become chaotic, right? People freeze, deer in headlights type of thing. Exhaustion, overworking causes chi to become consumed because you're using it up as you're working. Overthinking causes a lot of worrying, nodding, binding of chi. You feel that pit in the stomach or butterflies in the stomach. I don't feel so comfortable. Food doesn't digest very well. So these things were already being discussed, right, as of the 39th chapter. And a lot of this is very common sense for you, but I'm just laying down this groundwork so you can kind of understand things. We're going to go a little more rapidly because some of this stuff is on repeat, but I wanted you guys to see the different perspectives here so you can understand also that it's not always a one-to-one. I know today in modern Chinese medicine, we like to say anger affects the liver, but it also affects the lungs, and we're going to see that in a bit. So you get these kind of emotions that will affect other things as well. So I've given you here in the notes the idea of the 7 emotions, right? The qi qing, and the idea of what they cause qi to do. This is very important because you will find symptoms of this in people with emotional trauma, and especially strong emotional trauma if they're not drugged up. A lot of people, like a lot of vets I would see, they would come in with literally pill boxes, like like a large book, but it's a pill box, and they have to take one in the morning and one little box in the morning, one in the afternoon, one in the evening. So they were very drugged, right? Or people are heavy on lithium and these different mental stabilizers. You won't find that the movement of chi, the symptomology is very apparent in them. However, if they're not on these drugs, you will see this very, very apparently, right? So the idea of anger raises chi, excitement, like I said, dissipates or scatters, grief diminishes or descends. Pensiveness, like we said, pensiveness is really the word, not really worry. And I want to differentiate this for you guys in a second here. Pensiveness knots chi. Depression is more of an anxious worry. It's called yo, right? And yo is a common term used in the Huangdi Meijing. It binds and descends chi, right? So you get this anxious worry. Kong is fear, and it suspends chi. It suspends it from being able to move, but then it moves it downward and inward, right? You retract, right? You want to cover up when you're fearful of something. You feel this wanting to say, if you're a mother, you grab your kids and you pull them into you, right? If there's a car coming, right? Fright is just creates chaos. It scatters chi, right? It's an extreme version of the loss of kidney yang, just goes poof, and you don't have the ability to think at all clearly, right? Now, what I want to say about the difference of uh, um, worry. This is something that's really important. So in the West, in Asia, in China, and Taiwan, the concept of worry is a little different. There's 2 types of worry. One is worry of the heart. That's anxiety. That's anxiety over things you can't control. You're anxious over whether the plane you're on is going to crash, whether your kids are going to get home safe, whether um, uh, the president you hope for is going to be voted in or not. Things like this. You can't do anything about it, right? It's up to the universe. That creates anxiety. That creates excitement in the chest, and it dissipates chi. That's that excitement, right? Sometimes referred to as joy, xi, but xi has a lot of meanings. It can also mean excitement. However, worry or pensivity over things you can control. You're going to have a garden party. How many chairs did I put out? Did I put out enough chairs? Should I put out another one? I'm not really sure. All of these worries over things you can control, that's pensiveness. That binds and knots chi. So think about that when you're looking at somebody. Is somebody worrying over things that are in their control? Or are they worrying over things that are outside of their control? If it's outside, it's heart, it's anxiousness, it's excitement. If it's something that they can control, it's pensiveness, right? So it's the stomach, the spleen, things like that. So again, I gave you the emotions of the 4 or the 5 movements of chi here, but there's also a positive aspect, right? So anger raises chi, but it also rouses courage, right? You get angry and you're going to punch through this fear and you're going to do this thing, right? Anxiety, the other aspect, it dissipates chi, but it opens the heart. It might dissipate it, but it opens it. You're so excited that your friend came. You have this joy that your friend is here, and or your loved ones that you haven't seen in a while. Your heart just feels like it wants to open wide, right? Grief descends chi, but it also what? Descends and helps to let go of things. You cry, you release. So it helps to release attachment, right? So these are actual positive aspects that you can look at. It's not all negative, right? It's just is, and we put a negative or a positive context on it depending on the state of the person. Pensiveness binds chi, but it also, as it binds and knots things, it creates a focused concentration and attention to something. So if it's these things are done in the right amount, you get a positive outcome, right? Calm suspends chi, fear, right? Suspends chi, but it also moves chi inwards in an effort to protect the body. If you had no fear, you could do things that were very dangerous to yourself, and you would never think to protect yourself for certain things. Oh, a car's coming, big deal. It might hit me. It's not a big deal. I'm not scared of it. Well, maybe you should get out of the road a little quicker so it doesn't hit you, right? That dog is starting to growl at me. Maybe I shouldn't touch it. These things that allow your cognitive ability to work. So there's not always a negative aspect to them. So think of it, you've got a sort of two ways to look at this, right? Now, when it comes to the spleen being at the center, this is the organ of thought. It gives you cognition. It also gives you in chi, right? It produces that nutritive chi in blood, right? To continue to think about a situation. Therefore, it controls the expression of the emotions because you can think about your emotions. You can think why you're angry. It's not just an expression and I'm done, like living in the moment, like we hope to be. Oftentimes, you think about those emotions after. You can decide when or not to obsess about a specific emotional response. After something happens, you're angry at somebody, you go home and you're still angry. And I'm still going to be angry because your spleen is telling you, I'm going to give this an energy. I'm going to still be angry at this because I'm thinking about this, right? With that said, this allows a person to allocate blood for cognitive pensiveness over something, or maybe not. Maybe you're like, you know what? Screw that. I'm not going to give that any more mind. I'm going to do this. That's your spleen also choosing. Nope, not going to give it the energy. I'm going to do what I'm supposed to do. This is the earth forming boundaries, right? I'm not going to do this thing over here. If you have a strong earth, then it will tend to form these boundaries and let those things go. If the earth is weak, then you tend to easily be told what to be upset about, right? We see this a lot on social media today. People have a manufactured emotion based on what they're told to be emotional about next, right? So this is something that you can kind of see with people today, especially people who doom scroll, right? It's a form of like slow burn emotional trauma. They're looking at all these terrible things right now, fires in California, war in the Middle East, uh, I'm in Taiwan. People look at the possibility of war here, war in the Ukraine. They doom scroll, right? And this creates this low level emotional tension. Your spleen is giving this energy. It's creating these problems. Maybe I'm getting fearful over this. Maybe I'm getting angry. Maybe I'm getting anxious. The spleen is choosing to do these things. It's choosing to give this energy. And this is also, if you want to get out of that, you have to take that mental control back. You have to strengthen earth to say, I'm not going to do this, right? Because you can actually mentally hemorrhage over these things. You can give something too much blood. The spleen will give it blood because it has Shen in it to do this. And you'll mentally hemorrhage this blood. You'll give up these feelings to have, or these thoughts to have these feelings, and you'll get stuck on them, right? And then you'll have an issue. However, when things go very deep and somebody doesn't want to talk about something, but they feel it inside, they don't want to let it go. This is a sign of spleen chi deficiency, right? You see this in patients. No, it's fine. I don't want to talk about it because the minute they talk about it, those emotions come out, right? And they come out in full amount. This is a sign of spleen chi deficiency. When you take the pulse of those people, you're going to find many of them are spleen deficient because they're not able to form boundaries for this and let it go, and they're not able to, they kind of hold it and they think about it for a long time. So people will hold on to extreme emotions for a long time, can create spleen deficiency. People who are 60, 70 years old who are still angry about something that happened in high school. You know, these type of things can sit with people for a long time and you grind your teeth about them, you're pensive about them. This is all the stomach and the spleen trying to work, and you can create a deficiency, right? You can create a spleen chi deficiency. The emotions and the narratives that we give ourselves, the emotions are narratives that we give ourselves about our lives. So the spleen, like I said, will manage the production of blood because it creates the red substance. The Ming Dynasty, they talked about this thing called uh, uh, the Hongxie, the red substance, the red colored substance. And mm, this substance would create blood. And the E that manages the blood. The E is the mental aspect of the spleen. It manages it, tells it where to go, how to have excuses and rationales. This is what also allows cognitive therapy to work. People who have a strong spleen can use cognitive therapy to try to work through things. People with a weak spleen may find cognitive therapy is a lot harder because they have trouble creating boundaries in their minds to deal with things. But the fact that we have a spleen and we have a mind, an E, is why we can use cognitive therapy. So emotions as movements also can create pain. You have actual symptoms that can go along with them, these somatic symptoms, right? Fear, right? Associated with the kidneys, right? Can create back pain. Anxiety associated with the heart can create heart palpitations. People get palpitations when they're anxious, right? You see this a lot. People are anxious all the time. You guys all know this. These are your basics. You all know, right? Anger. You can see things like high blood pressure, liver fire from being angry over a divorce that never resolved, right? Now the person is drinking, and we think of, oh, well, it's from the alcohol. Actually, it probably comes firstly from the fact that they're angry and they're not letting it go. And they're constantly, the spleen is giving them the yin qi and the blood to constantly think about this, right? So they get red eyes and vertigo, sadness. You can see coughing and sadness, increased urinary and defecation, right? Our urination and defecation, right? Crying, the release of that, right? Pensiveness, overthinking with digestive issues, right? Sluggishness, people think a lot, a lot, a lot. For example, Japan is a culture that happens to be very pensive. They have very high rate of stomach cancer. So these type of things tend to happen. They sit for long days in office chairs. What? Thinking about their job, always thinking about these things. This can create in your patient's stomach issues, right? Sometimes you can see symptoms that are both in the upper body and below. When you have this, or they alternate between emotions, maybe they're anxious and they're sad. So things come up to the heart and it suspends and releases things, and then things go in and down because of sadness, right? You can have this is an idea of Sanjiao. So in the case of this, sadness and anger, sadness and pensiveness, I'm sorry, sadness and anxiety, you can have upper and lower symptoms. So somebody who has increased urination defecation with red eyes, sorry, it's a typo, red eyes, high blood pressure, and headaches. You're like, well, that's a couple of things. It's probably experiencing two or more emotions associated with something. And so in a case like this, you might want to add the Sanjiao low point, Wai Guan, Sanjiao 5, to help mediate between the upper and the lower movements of things. So, for example, if somebody feels they have headaches, they get a lot of headaches, and they also feel like they have a lot of urination, right? So this would be something where, and you notice that they're kind of sad, but they're also angry. They have this, maybe it's a depression, right? But it's a depression mixed with anger and sadness. A lot of times in clinic, you'll see anger and sadness mixed together to create an anxious worry that creates depression, right? Yo in Chinese. And so this is something where you have two things. And as you treat it, as one emotion becomes stronger, if one emotion becomes stronger when you treat it, then you know it's the other emotion generally that's the root. If you're treating one emotion and the other emotion seems to dissipate, then generally you've treated the root. But if you're treating one emotion and the other one gets stronger, then it's the emotion that's getting stronger that's actually probably the root emotion causing an issue. Everybody with me so far? I'm just double checking here to see about, no, we got a chat thing. Okay, we're with me. Cool. Excellent. Great. All right. No, sorry. Let me get this out of the way here. I'm going to put this over here so I can see. All right. All right. Great. So let's keep going. So you'll find emotional changes to the organs. So one of the things, sorry, I gotta shut this chat. I can't see. One of the things about this is that you're going to find over time, if you don't release this, if you're not able to treat the PTSD or resolve it mentally or the strong emotional trauma, it'll start to affect the zangfu, right, the organs, and the jingmai, the channels, and also the levels of the wei, the yin and the yuan qi. And this is going to have effects on the person, in layers. They're going to affect their physical body, their mental ability to think about things, and also their ability to connect spiritually with things around them, right? You take them to a beautiful place, you want them to calm down, you want them to feel nature around them. They can't. They feel like they're broken from it because of all of these emotions, right? So these are things that will be affected. Some people can go to a church and feel a connection with God or a temple of some sort or whatever. Other people feel like they don't feel anything, right? They just don't feel like they can connect with that spiritual feeling, especially because of strong emotional trauma. Or maybe they feel dirty, God doesn't want them, all these things. These are things that can really, especially with PTSD and very severe emotional trauma, can really affect a person. Um, Oftentimes rape victims, for example, feel dirty. Nobody wants them. They feel awful about something that was done to them, especially if it's over and over. How could God let this happen? But God doesn't want them. They would never, these people would never be seen um, by God to be somebody good or worthy, regardless of whatever your religion is, right? These are things that you help them to work through this type of treatment, and it can be very, very effective. So I've given you the association here with liver. I mean, with the like liver, heart, spleen, lungs, kidneys. You guys know this already. This is basic, TCM 101. But I want to talk a little bit about what the Huangdi Neijing says about this, because Huangdi and his teacher there, Chibo, talk a lot about this in the Huangdi Neijing. So again, this is all from the same chapter. We're mostly going to be in Benchen chapter 8 of the Huangdi Neijing in the references. And this is purely, we're going to go through this a little fast, but this is for reference for you guys to understand where the root of this comes from. Because the treatment we use today is not necessarily found in the Huangdi Neijing. They don't always talk clearly about how to treat it. The interesting thing is I'm going to teach you a usage of the Luo Mai that actually comes out of Taoist methods. And what I mean by that is historically, if you think of um, psychology as a modern development in the 20th century, where did it come from? Psychology was developed from uh, generally religious practices in times before the 20th century. Where did you go if you had, mental issues, emotional issues? You went to find a priest in just about all cultures, or a shaman, right? That's where you went. You went to see your priest, whether you were Jewish and you saw a rabbi, or you were Christian or Muslim, or in Taoism or Buddhism. They developed a lot of these psychological treatments that then modern psychology brought into itself. However, interestingly enough, um, with the advent of TCM, a lot of that was taken out because in China, even though they were looking to treat this stuff, they were looking to model it after the West. Communism is not a big fan of a lot of the psycho-emotional models of uh, more classical practices of Chinese medicine. So when I say classical, obviously people will say, oh, Han Dynasty, or I'll even say Tang Dynasty and before, but I mean basically anything from the 1800s in this sense. Before the modernization of China, you had a lot of other things that could be practiced. And a lot of that, but you would, at the time, you wouldn't go to your doctor necessarily for that treatment. You would go find a priest. You would go stay in a temple for a month or 2 months, learning to meditate, being treated by the priests with acupuncture or other methods, herbs, other things like that. You would be on strict dietary regimens. And so these things came from the religious um, areas and then were brought in modern times out. So, for example, we learned this from Jeffrey Ewan. These are treatments that came through Taoism. And you don't find a lot about this specifically in the way that he taught it in the Huangdi Neijing. And I've asked him about this, and he says you would have to go to the Daozang and you would have to kind of see this through the presentation of the Daozang and the different scrolls there. However, the problem with that is there are 1,300 scrolls in the Daozang. And so this is the reason why it's kind of difficult to find that. But um, you'll see that this has a lot of resounding root in the Huangdi Neijing's theories as we go through. So the liver stores the blood. It's a residence of the Hun. When it's empty, you have fear. When it's full, you have anger, right? So remember what I said before? When the liver qi rises, when you have anger that rises up, you can confront fear. But if it's empty, it can't confront fear, right? So you can have people whose liver is deficient and they're fearful. They're constantly fearful because maybe they tried to stand up for themselves. And even when they stood up, somebody beat them up, right? Something happened that broke them mentally where they could not react to that thing. And so therefore they developed a fear, their liver became deficient, right? Their anger inside to try to stand up was smashed by something else. And so therefore it becomes empty afterwards. This could be something you have to tonify a liver for, right? The spleen stores the yin qi, right? And the yin qi lodges the yi. When the spleen is empty, the four limbs cannot be used. You don't want to get up. You're lethargic. You're also can be very, very depressed, right? You can have this also, the five zang, different organs are not settled. You can feel anxious. You can feel pensive, right? And you can get a lot of abdominal bloating and difficulty urination. I know you guys see this in pensive patients, right? You see a lot of digestive disorders, right? The qi knots, it tends to knot. The heart is a depository of the vessels. It houses the shen. The heart chi is empty. When it's empty, it's followed by grief. You don't have joy. You can't find excitement in your life because it's you have heart T deficiency. But when it's full, you can have obsessive laughter. So this is somebody who becomes obsessive about something, obsessive laughter, too much excitement, and you can feel when they laugh, it's just not right. Like something's not right. You guys have all seen this, I'm sure. Even in movies, for example, the laugh of the Joker. Right? There's a perfect example of obsessive laughter. Um, uh, Somebody who's trying to impress somebody else and laughs at all of their jokes to try to impress them. And the laughter is super, super awkward and it goes on for way too long. That's an example of Archie is a little full. They're obsessing over this thing, right? So that's the idea here. Let me see. We got a question, I think.